Good afternoon, everybody. In this webinar, I would like to talk about the use of social media in radiology. The goal of this presentation is to give you an introduction to social media, to provide you an overview of the evolution of social media, to talk about the value of social media for radiologists, and to discuss the question if we should engage in social media or not. First of all, what are social media? A good definition is provided in the booklet of Bertel and Mesko, and he defines social media as a group of internet-based applications that build on the ideological and technological foundations of Web 2 and that allow the creation and exchange of user-generated content. The web hasn't been the same as we know it now. In the early days, and then we talk about the Web 1 period, the internet was much more static. The users were mainly consumers of content, and there was very little interaction between users, or much less than we know it now. The social interaction in that period took place via email or mail-based discussion groups and news groups. So for users, it was kind of difficult to create online content themselves. And the number of contributors was much smaller than the number of contributors that we have now. This is an example of the way how social interaction took place in the early Web 1 phase. It's a screenshot of the website of the EUFORA mailing list, the EUFORA European Forum for Radiologists. It was created in 1998 and existed till about 2001. It was a discussion group using a mailing list, which means that messages could be sent by mail, and the address of the mailing list was used to distribute messages to all the members. So the mailing list was also linked to an image database with a website. The images that were stored in the database were simply JPEGs and not in DICOM format. The mailing list had about 445 members from more than 45 countries, and the interaction was kind of intensive. There were about 2 to 3 messages a day were being sent, which in that early period was quite a lot. The goal of this mailing list was to support radiologists in electronic communication and education, and it was also the intention to create some interaction between radiologists. I will show you how it worked. Here you see an image that was stored in the database and shown through the Conrad website. Everybody who uploaded an image or a case could add some information, and then a communication box was provided through which other users could add some comments. So for every user that added some comment, it was possible to send the comments to the EUFORA list, and by clicking this button, a message was generated that was sent to the mailing list, so everybody received it. And from this mail, by clicking on a hyperlink, the users could immediately see the image on the Conrad website. So this way they could also add their own comments, and the circle was round. So kind of a discussion was created this way. Now we are using the web, or we are, let's say, working with social media in the Web 2. And the Web 2 is completely different because it allows the creation and the exchange of user-generated content. It means that the architecture of the web or internet has changed a lot. In comparison with Web 1, the Web 2 is called, the Web 1 was rather the read-only web, and the Web 2 now is called the wildly read-write web. So users, they can provide content themselves much more easily. This is called an architecture of participation, and users have much more control over the data that are being shared and distributed through the internet. By collecting all this information from all these users, it is also said that some kind of collective intelligence is being created. These are a few examples of social media as you probably know them, and which you also have used probably. And as you can see that from this graphic, the usage of social media is increasing. In January 2014, about 74% of all online adults were using social networking sites. But as you can see here, the younger generations are using it much more intensively than the older generations. And from this graphic you can see that the usage of social media is increasing year by year. Also, physicians are using social media, and they can do it for either professional or private reasons, or they can do it for both. When I say professional, I mean health-related or educational and scientific. As you can see from the study from the PEW Research Center, the most popular social media are Facebook, LinkedIn, Pinterest, Twitter, and Instagram. And you can also see that their popularity is slightly increasing year by year. Now, for radiology, there are different types of social media. First of all, we think about the social media that provide news and information on radiology, and then I think about, for example, the Facebook site of the European Society of Radiology. We also know the social and professional networking sites like LinkedIn. ResearchGate is a good example of a scientific networking platform. Of course, we all know Twitter, which is a so-called microblog because of the short texts that are being sent. In every tweet, there is a maximum of 140 characters. The blogs are also belong to the social media. The text is much longer than in the microblogs, but it's also possible to send comments or to interact with the author of a blog. Of course, YouTube has a lot of information for radiologists, and these are mainly educational videos, and it's also possible to share these videos or to comment on these videos. Pinterest is a good example of a social bookmarking platform, which is made to mark and share interesting documents. Then, as you know, clinical cases and images can also be shared through social media. For example, Radiopedia is distributing on a daily basis interesting cases on Facebook and also on Instagram. And then we have a platform like SlideShare, which can be used to share presentations. Every user can upload his or her presentation and share it with others. And of course, this list is not complete, and it's ever expanding. Here I can show you an example of a scientific networking platform. It's ResearchGate, and it's kind of interesting because every user is assigned an RG score. The RG score is calculated based upon the publications in your profile, but also on how other users interact with these publications. For example, the amount of comments they provide, or the popularity of your publications. So this way you can actually measure and also leverage your standing within the scientific community. And as you can see from this graphic here, it is shown what's your position in the total group of ResearchGate users. This is an example of a communication which took place through ResearchGate. I sent a question to the other users about bowel ileus and how it can be caused by fruit stones and how it looks like on a CT. And from one of the responses, I could even directly click on a hyperlink and open an interesting article in which a case of bowel, a case of ileus caused by fruit stones was shown. In 2015, a RANSOM survey was conducted to ask radiologists how they use social media. And the survey had 516 participants from different parts of the world. The majority came from Europe, but almost a quarter of participants came from North America. Participants were both radiologists and residents. And the results are published now in the Journal of Digital Imaging. From this survey, we learned that radiologists are using social media mostly for both private and professional reasons. This is more than 75% of all participants. Almost 15% is using them for private reasons only, and even less, almost 10% is using them for professional reasons only. The preference of radiologists for social media is, well, the most popular platform is clearly Facebook, but then we are looking at the platforms that are being used for both professional and private reasons. LinkedIn is the second most popular one, and Twitter the third. There is a smaller group like which is represented here, and the WhatsApp application, for example, is also included in this smaller group. When asking radiologists what platforms they prefer for professional reasons, you can see that LinkedIn is the most popular one. In Europe, it's clear that LinkedIn is being used most frequently for professional reasons. But in the United States, however, Twitter is the most professional platform for professional reasons. A study was published by the MedData Group about usage of social media in medicine, and it shows that 44% of participants is not using them professionally, but this means that 56% is using them professionally. And also here you can see that LinkedIn is the most popular platform for professional purposes. 60% of participants is using social media mainly for personal reasons. More than 20% does use them for to keep up with healthcare news, and almost 20% wants to use social media to engage in discussions with peers. From the RANSOM survey, we also obtained a lot of interesting information. And here we can see that the majority is using social media to stay informed about the latest news and the developments in radiology, 65%. Almost 50% is using them to communicate with colleagues about radiological topics. And 34% is using them to share and discuss interesting cases with colleagues. Almost 30% wants to use the social media to increase their influence and to promote ideas among radiologists. And a little bit less, 27%, wants to make the profession of radiology more visible for patients. A quarter of all participants uses social media to make their expertise and knowledge available for teaching purposes. Almost 20% wants to market their team and their services through social media, and almost 20% also wants to become more social with patients and clinicians by using social media. 17% wants to enable people and patients to communicate with radiologists directly through social media. Only 7% wants to inform patients about the examinations they will undergo, and only 6% wants to get feedback from the patients, of course, which can be both positive and negative. Only 4% wants to discuss radiological images with patients through social media, and surprisingly, only 3% wants to apply for a job or to be visible for recruiters in social media. What concerns do physicians have? when using social media? Well, the majority, and from this is the metadata group. These are the metadata group results that are shown again, but a majority of 52% is concerned about the privacy. And another concern that is frequent is the fact that most physicians don't have time to use social media. And physicians also do have concerns about liability when using social media. From the RANSOM survey, we also learned that the most frequent concern radiologists have is the fear of mixing private and professional messages in their communications. And the second most important reason not to use social media is the lack of time to use them. So this actually confirms the results from the metadata group. Radiologists do have concerns about using social media, and 3/4 of all participants think there is insufficient legislation and guidelines for social media in healthcare. Almost 40% also thinks there is a risk for both patients and radiologists, for their privacy at least. 37% of all participants say there is insufficient knowledge about social media among radiologists. Almost 30% are afraid that radiologists can be distracted from clinical activities when using them. And almost 20% think that social media are withholding radiologists from real social contact with others. And only 13% is afraid of the danger of negative comments on their clinical practice. This is an interesting example of how social media can be risky for patients. It's a tweet from a celebrity, a famous athlete, and in this tweet he attaches a picture of the report that was made of the MRI of his knee, which also shows some, well, let's say severe pathology. So I think this is kind of risky to show this in public. This is a picture from a paper, a magazine, or let's say a journal from the United States, in which it described that the anesthesiologist was not monitoring the patient sufficiently because he was active using his social media. He was actually distracted from doing his job. And this is a picture from a Belgian journal showing a picture taken by a resident in the operation room and showing the equipment they were using. So the hospital was not very happy with this. I also would like to say a few words about WhatsApp in the Netherlands. WhatsApp is a very famous or very popular platform in the Netherlands. It has more than 9 million users, and this makes it more popular than Facebook itself. A study at the Albert Schweitzer Hospital showed that 40% of doctors is using WhatsApp for professional purposes. And in the messages that are being sent, in 33% of these messages, the name of the patient is even mentioned. In 62% of the messages, the picture of the patient is included. And this percentage might even be higher when talking about residents only. So although social media are being used for the benefit of patient care, most specialists are not aware of the lack of privacy when using this type of public social media. This is also an interesting story of a Dutch radiologist, and it was also published in a magazine in the Netherlands. It's a story from an interventional radiologist who got a picture from a colleague through WhatsApp at 11 o'clock in the evening, and it showed an angiogram of a patient that was in coma and almost dead. The colleague wanted to know what he was seeing on the angiogram, and the interventional radiologist, who is a specialist in cerebral stroke, he could see what it was, and which was a thrombosis of the basilar artery with a rare anatomic variant. So he could explain his colleague what was the problem, and he could also explain how to deal with it. So this way the patient could be treated efficiently, and the patient could also go home after the treatment, which is of course a good story for the patient. In this hospital, radiologists, they started to use WhatsApp on the incentive of radiology residents who were all using it. And the story also shows that WhatsApp can even be very useful for fast communication in emergency cases like stroke. It can even be life-saving. Another study was performed by the Royal Dutch Medical Society, and from this study it was also shown that 44% of interrogated doctors is using WhatsApp for professional reasons. They do it to have contact with colleagues, to send pictures, to make diagnoses, and even to obtain second opinions. I also would like to show you these results from a survey that was conducted in 2013 about the PACS and IT systems in Dutch hospitals. All academic hospitals in the Netherlands participated, and almost 50% of the non-academic hospitals. From the survey, it appears that 77% of radiologists is still using CDs or DVDs to share images. The question was asked if the radiologists would support the ability to exchange radiological images digitally with other hospitals, and from the results it is shown that 93% is in favor of a digital image sharing system. So there is a definite need for digital image exchange. Of course, you can do this in different ways. First of all, you can use a private cloud system, and by using such a model, an institution, which in this case is institution A, can upload images to the private cloud, and this is done securely by using an encryption, and from the private cloud the images can be distributed automatically to other hospitals or to a physician's office, or maybe to a radiologist with a mobile device that is able to use a secured application. Image exchange can be done differently as well, and as I told you in the Dutch story, this is, for example, by using the public cloud, in which is also located the WhatsApp. So when a radiologist in institution A is making a picture with his smartphone from the workstation, and then he sends the image through the public cloud to another radiologist in hospital B, which receives it on his own smartphone through WhatsApp, then of course the public cloud is being used, which is not secure because the data are not encrypted. So there is a security risk when using this type of social media. And I'm not only talking about WhatsApp, but also about other platforms like Dropbox. It is a fact that medical images are being shared through this type of public platforms or social media, or images are even stored in the cloud. But these media are not designed for safe distribution and archiving patient information. There are some security risks involved for the patient, because the patient can be identified when pictures are being sent through applications like WhatsApp. The image can show the face or a tattoo which is recognizable. The images are usually not anonymized, and from the metadata of the picture, a lot of information can be obtained about the location and the time where the picture was taken. In most cases, the informed consent principle is not applied, which means that patients are not asked permission to do this. There is also a privacy legislation in Europe, and so according to this legislation, it is not allowed to store patient data on servers located outside of the country. So a secure or a private cloud model, or another safe way of sharing images digitally, needs to be embraced. We should encourage the seamless data transmission between hospitals. So of course we should get rid of the old system of CDs and DVDs, but when transmitting images digitally, we should encourage using a safe model. There is a new generation of applications, however. We know that young physicians are embracing the digital revolution, so they want to share complex or interesting cases with other residents or other healthcare professionals, and for that purpose they use their mobile devices and they use social media. So when doing this with the popular social media, the patient's privacy is not protected, and the main reason is that personal data cannot be removed. An example of a dedicated platform or a social media application is Figuren. It's also called the Instagram for Doctors. It's founded by a Canadian intensive care doctor, Joshua Landy, and it's not only used for sharing interesting and tough cases, but it's also used to archive these cases so that you can always look at the archive afterwards for teaching purposes. This application needs to be officially approved, and first of all, it's a free application, and it started in the English-speaking countries, but now it's also expanding to other European countries, such as the Netherlands, France, and Germany. So before it's being launched, it needs to be approved by health authorities in every country. The users also have to sign up and identify themselves as a healthcare professional, and they also need to go through a process of validation of their medical license. The application also includes automated protection tools to remove patient-sensitive information, and I will show you how it works. On the left side, you see a picture of a patient that was taken with the Figuren application, and you can see that the face of the patient is automatically obscured, and it's also possible to obscure a tattoo on the arm by using the application appropriately. Each photo is even reviewed by moderators before it's being added to the archive or to the database. In the RANSOM survey, we also asked a question about Figuren, and from the result, it seems that a majority does not even know about its existence. That's more than 73%. About 13% does know it and has used it already, but a similar amount of users knows it but doesn't use it. From our survey, it also seems that a majority does not like platforms like Figuren, more than 60%. But all the others do like it, and they do like it because of educational reasons, and because it's also encouraging international collaboration. Another advantage of a platform like this is that images can be shared safely and easily, and it also allows radiologists to offer their expertise to other specialists, because Figuren is not only being used by radiologists but also by other specialists. But surprisingly, only 2.6% likes it because it's very safe to use for both patients and physicians. And only 2.6% likes it because it's supported by the country authorities and academic institutions. Of course, the Figuren is just one example. There's other new dedicated applications that are being developed. For example, in the Netherlands, a new application is called Kanta, and Kanta is using ways to, let's say, secure the fact that users are medical doctors or radiologists. Papers is also a very interesting software that I would like to show you because, well, as you probably know, Papers is made for Apple users, and it's a software that allows you to store your scientific papers on your computer. But it does a lot more than this. When you read an article, you can also look for comments about the article that have been distributed through Twitter, for example. And for this article here, you can see that several comments have been provided in Twitter. And by clicking on one of these, you can directly read what was said by the author. And of course, you can also send another comment. This is an interesting paragraph from a recently published article on sharing radiology research on social media. It was published in the JACR by Jenny Huang. And it is said that the use of social media for professional purposes is growing rapidly in medicine, despite a degree of skepticism from many academicians that is accompanied by concerns about scientific rigor, privacy, and the uncertainty about the effectiveness and overall value of social media. From the study, it was concluded that additional evidence is provided, suggesting that dissemination of scientific findings and discussion via social media results may increase the reach and visibility of such research relative to traditional peer-reviewed journal publication alone. So using social media can increase the visibility of research and cause an active discussion about it. So should radiologists engage with using social media? Well, I think that we have to engage, and it's in the benefit of the patient to do this. It can also be of benefit for other colleagues if we can help them with difficult cases. It also enables us to communicate with clinicians more often and more efficiently. Social media also allow us to interact online, even with patients. And overall, this can improve the quality of care. Additionally, social media allow us to evaluate and discuss scientific work. And, well, I think that by using social media, we can also become more visible as radiologists. We might even become more social again. And, but one thing that we should remember is that patient privacy is extremely important. So, in summary, we can say that it is important to understand the concept of social networking, and it's also important to understand how you can leverage social media in your practice. Of course, it's important to understand how you can use them to enhance collaboration, networking, education, and to keep up with information. We can also conclude that healthcare professionals need tips on how to use social media appropriately, securely, and safely, and on how to avoid pitfalls so that they can uphold their professional values. And in conclusion, I would also like to say that appropriate use of social media can result in better patient care. So let's prepare for the future, let's connect, and let's share. I thank you very much.